I'm going to attempt to show you what I do with mirror therapy to ease the pain of this injured ankle. Yesterday I turned this ankle and as you can see it's swollen and the bruising's coming out. This is the mirror I use. From this side my foot is hidden at the back. This side I have my foot that hasn't an injury on the floor, and if I look in the mirror I can see the mirror image of my good foot. Now I move both my feet in a way that would be hurting my bruised and injured foot. Yesterday I couldn't wriggle my toes. I started by moving my toes in a way that would hurt the other foot, and in fact I couldn't do this at all to begin with. I kept doing it, moving both feet as much as I could, and after about 30 seconds my injured foot was able to curl the toes in a similar way as you're seeing here. Then I moved my foot up and down. I couldn't do this yesterday initially with my injured foot, but after doing it for about 30 seconds, trying to move the injured one whilst looking at the good foot, I was able to move it. Not quite the range of motion that you can see here, but nevertheless I could still do it. Then I pressed my foot into the ground and watched myself visibly touching the ground with my foot. I did this with both feet, and I've continued to do this again today. This is the 5th time I've done it now. The pain is significantly less. The movement is much greater. I'll show you now. I'm able to wriggle my toes with my injured foot. I'm able to move my foot up and down, and I'm able to put my foot on the ground. I couldn't bear to do this yesterday. Mirror therapy works. You need to make sure you look at the actual place that's injured, the mirror image of it. So there's no point in looking at the good foot moving. You must actually look at the mirror image and do some, well, at the moment I'm doing the recommended treatment, recommended practice, and that is moving both feet at the same time. Accidentally yesterday I moved my painful foot at one time without moving the other one, and it had a very strange sensation, almost like feeling dizzy and wanting to pass out. It's a very strange feeling, so it's a mismatch of messages. I hope this video helps you understand better what works for me.